Hi everyone, my name is Megan, and today I'll be talking about leukemia as it relates to the otherwise health impaired category under IDEA. Learning while healing, leukemia and OHI supports in schools. Have you ever had a student who seemed constantly tired or frequently absent, but you didn't know why? Not every student's journey looks the same. Some are navigating a very different path through illness and recovery. I know this firsthand. My nephew is currently fighting leukemia, a type of leukemia called acute myeloma leukemia, for the second time. Most of his days aren't spent in a classroom, they're spent in a hospital bed away from his friends, routines, and teachers. As you can see, some of these pictures are of the same little boy, and that is my nephew Bennett. Today, I want to help you understand what leukemia looks like in students, what we can do to support them, and how teachers can make a difference, even from a distance. For some students, learning takes place far from the classroom. It takes place in hospital rooms, not in school desks. What is leukemia? Leukemia is a type of cancer of the blood and bone marrow. It affects how the body produces white blood cells, which are essential for fighting infections. Some common symptoms include extreme tiredness, frequent infections, bruising, and bone pain. Students undergoing treatment may experience side effects like hair loss, nausea, and especially fatigue. As teachers, we may not always know a student has leukemia unless families choose to share that. But if we do know, there are a few things to keep in mind. First, students may miss a lot of school for treatments or hospital visits. They might also be immunocompromised, which means they're more vulnerable to illness. They may also struggle with attention or memory, sometimes called chemo brain, or they might simply be exhausted in the middle of the day. These are some side effects that also affected my nephew. What does it look like in schools? Students with leukemia may look more tired than usual, with pale skin or dark circles. They may not even appear sick. You might notice hair loss, bruising, or nosebleeds, which these are very common side effects of treatment. Some may wear hats or scarves for comfort or have medical devices under their clothes. These signs help remind us that their body is working hard to heal. How do we support students with leukemia in the classroom? First, flexibility is huge. That might mean extended deadlines, modifying assignments, or letting them rest when they need to. Second, work closely with the school nurse, parents, and special education team to follow the student's 504 plan or IEP if necessary. Socially and emotionally, students may feel isolated, especially if their appearance changes or they're absent a lot. We can help by fostering a kind, inclusive classroom environment where differences are respected and no one feels left out. Here are some helpful tools and resources. And if you want to learn more about leukemia and how to support students, there are great resources out there. The Leukemia and Lymphoma Society offers free teacher guides and family resources. The American Cancer Society has helpful info for educators too. And of course, always reach out to your special education coordinator and parents if you have a student in your class with serious medical condition. Supporting students with leukemia isn't about having all the answers. It's about being flexible, compassionate, and willing to work as a team. These students are fighting a hard battle, but with the right support, they can succeed in school and thrive. So I'll leave you with this question. How might your teaching look different if you had a student with leukemia in your class next week? Think about it. Thanks for watching.